Welcome, everyone. Welcome back to my channel, Healing Speaks Chrissy. I hope you all are doing amazing. So, as you can see, the scenery is different. I am on the computer using the webcam. So, yes, the camera quality is different. Now, I'm actually hoping that the webcam stays in focus during the recording of this video. So, I'm on the computer because I want to show you all some material that I do have prepared for you. Now, I mentioned in one of my videos that I was talking to one of my lovely subscribers on one of their videos, and in the comment section, this person asked me, how was group therapy and did it work for you? So I said, you know what? I'm going to make a video about it. And here I am making a video about it. So I will be talking about different types of groups, the ones that I've taken, and it's considered intensive care. So this is not the type of video that you really want to, watch because you already know about group therapy. That's fine, but I may be talking about some groups that you never heard before. So if you want to stick around and listen to those different types of groups, I highly recommend that you stick around. But let's get into it. So what I need to do first is deactivate this camera so I can share my screen. And I want to come back on screen and you will see me in this cute little small bubble on the corner of the screen. So let me deactivate this camera first. So you're going to see me off camera. So I'm already on the web, as you can see, and then I want to activate another camera. So there I am on a smaller little bubble. So here it is. So I like to consider therapy like levels, like level 1, level 2, level 3, level 4. And like I said, I'm only going over the ones I've taken. So level 1 to me is like considered the basic therapy. You're seeing a therapist and a psychologist. And if you need more therapy, like you tell your psychologist, hey, I need some more therapy or I need some more, something else to help me. um, they will refer you. So this is how you get into these programs and these classes and these groups. It's usually a referral. So they refer you and then you get the phone call, you get enrolled, and then you start. So for me, after I was attending some therapy, the next step was PHP, which is right here. We're on PHP. So it may be different where you live, like depending on where you live. I'm in California. So PHP is one of the programs out here, and it's called Partial Hospitalization Program. So I will bore you a little bit by reading. I'm only going to read up to here. That's it. So let's read about PHP. So this is one of the ones that I have taken soon after, seeing a therapist or a psychologist. So it says here a partial hospitalization program, also known as PHP, is a structured outpatient mental health treatment program that offers a middle ground between inpatient hospitalization and traditional outpatient therapy. It provides intensive daily treatment for individuals who need more support than standard outpatient care but don't require 24/7 supervision. PHPs typically involved a combination of individual therapy, group therapy, medication management, and other therapeutic activities, all while allowing patients to live at home. So, yes, if you're attending a PHP program, you are allowed to go home. There's no supervision needed. You're able to go home. What makes it intensive is because you're there for so many days. You have to attend for so many days and so many hours. That's what makes it very intensive. But yes, you get to go home, no supervision needed. Okay, so let's go over the key characteristics of PHP. So, intensive treatment. PHPs offer a high level of structured treatment, often involving daily sessions, outpatient settings. Patients live at home and commute to the treatment center for daily sessions. Then, transitional care. PHPs can serve as a step down from inpatient care or a step up from less intensive outpatient programs. And then, multidisciplinary approach. Treatment is often delivered by a team of professionals, including psychiatrists, therapists, and nurses. It focuses on stabilization and skill building. The primary goals are to stabilize symptoms, improve functioning, and equip individuals with coping skills. Then, a wide range of conditions. PHPs can treat various mental health conditions, including depression, anxiety, bipolar disorder, PTSD, and substance use disorders. In essence, in essence, In essence, a PHP is a structured program designed to provide intensive mental health treatment while allowing individuals to maintain some level of independence and connection with their daily lives. So, yes, when you are attending PHP, you are not there, you're not, it's not like you're on a hold, a 20, a 3-day hold or something. That is inpatient program, which is the next one we're going to talk about now. So now I'm on the next one. We are going to talk about inpatient hospitalization program, also known as IHP. So we just went over PHP. P stands for partial. Now this is what I consider like level 3. Level 3 is when I talked about on my video how I was on a hold. When I was once on a hold, I was in inpatient hospitalization program. I got in this program through PHP. I was attending PHP. Something happened during it. I think I talked about it in that video, and then I was sent to IHP, the next level. So, what is IHP? So, an inpatient hospitalization program is a type of medical care where a patient stays in a hospital or specialized facility for a period of time, typically overnight, to receive intensive treatment and monitoring. It's a structured environment with 24/7 medical supervision, often for those with severe mental health issues, substance use disorders, or other medical conditions requiring close attention. So here's a more detailed breakdown. So as you can see, did you hear the difference between PHP and IHP? So with IHP, you are there overnight. You're not going home, and there is supervision involved. All right, so here are some key features. So it's intensive and structured. Inpatient programs offer a highly structured environment with a daily schedule of therapy sessions, group activities, and recreational time. So true. I can think about the recreational time. I did workout, pool table, checkers, you name it, like painting, drawing, things to help the time go by. And group activities. So we did things together. And then 24/7 medical supervision. Patients receive round the clock care from medical professionals, including nurses, doctors, and therapists. So true. I remember like every 15, maybe every 10 minutes, the nurses will have to check on where the patients are. They need your location. So this is like every 10 minutes, they'll say your name and you have to say here, or they'll just look at you. They have a clipboard. They needed to know where everyone was. They needed to check on you. This was like every, I think, 10 to 15 minutes. Yes. Even if you're showering, they needed to know the whereabouts of all the patients. So location. Treatment takes place in a hospital or a specialized facility designed for intensive care and monitoring. So the purpose. Inpatient programs aim to stabilize a patient's condition, address acute symptoms, and help them develop coping mechanisms for long term recovery. So, here's an example. So, examples: inpatient care can be used for mental health crisis, severe substance use disorders requiring detox, and other medical situations requiring close monitoring and treatment. So here's examples of inpatient programs. So mental health inpatient programs focus on treating severe mental health conditions like depression, anxiety, bipolar, and schizophrenia. Substance abuse inpatient programs like provide detox therapy and support for individuals struggling with addiction. And then general medical inpatient program offer treatment for serious illnesses, injuries, and conditions requiring hospitalization. And then it talks about inpatient versus outpatient. So inpatient requires an overnight stay in a hospital or facility for intensive treatment and monitoring, while outpatient patients receive treatment and return home the same day, often for less severe conditions or for ongoing care after inpatient treatment. Okay, so that is inpatient hospitalization program. Now, what did I say this was level 3? Level 4, I don't know what level really 4 is. I just call it level 1, level 2, level 1, 2, 3. And then there's a program usually when you're done with PHP and when you're done with IHP, you are sent to IOP. I know all these acronyms right now got me confused. So this is the program that a lot of PHP or inpatient programs will send you to when you complete them. You go to IOP. This stands for Intensive Outpatient Program. Lots of groups. And I took these in this order. This is how I took all of these groups and or these programs in this particular order. So when I was done with inpatient hospitalization program, I was sent back to PHP partial because they wanted me to finish that program. Because remember, I told you I was sent to IHP during PHP. They sent me to the higher level. So when I was done with um, IHP, I went back to PHP. But typically, a lot of these groups will send you when you complete them. They will recommend IOP. Woo, these acronyms, you guys. These acronyms got my head dizzy. I'm hanging in there. Let me know if I'm making sense. At this point, I don't even think I'm reading all these tiny words. At this point, I don't even think I'm making sense anymore. But let's now read about IOP, and then after that, I will come back to my screen and talk to you all about my experience of group therapy. Woo, my goodness, this is this is a tongue twister. All right, so IOP, here we go. So it stands for Intensive Outpatient Program, which is also known as IOP, is a structured form of therapy for individuals dealing with substance abuse or mental health issues, providing more intensive treatment than traditional outpatient care, but less restrictive than inpatient programs. IOP typically involves multiple therapy sessions per week, often including both group and individual therapy, and may also incorporate medication management and other support services. They almost kind of all sound the same. To me, this kind of still sounds like PHP. Okay, so it says key features of an IOP. Structured treatment. IOPs offer a more structured and intensive approach to treatment than standard outpatient therapy, but without the 24/7 supervision of inpatient or residential programs. So, group therapy. A core component of IOPs is group therapy, where individuals can share their experiences, learn from each other, and build a supportive network. So, individual therapy. IOPs also include individual therapy sessions to address specific needs and challenges, providing a safe space for personal reflection and growth. Medication management for individuals who require it. IOPs can incorporate medication management services, ensuring proper monitoring and support. And then other services. IOPs may also offer additional services like family therapy. Okay, I see. Okay, there's the difference. Additional services like family therapy, case management, and support groups. So the flexibility. IOPs allow individuals to participate in treatment while maintaining their daily routines, such as work or school. So you get to go home. It's not an in stay thing. Who might benefit from IOP? Individuals stepping down from a higher. So, see what I mean by stepping down. So, you're stepping down. So, individuals stepping down from a higher level of care, such as inpatient treatment, needing ongoing support. So I was sent to IOP after I completed partial hospital program. Now, like I said, when I was done with IHP, when I was on a hold, a 3-day hold, I was sent back to PHP because I wanted to finish PHP. So they sent me back to PHP. Now, when I was done with PHP, then I was sent to IOP. Make sense? I hope so, because I'm not gonna lie. This reading and all these acronyms got my brain hurting. All right, now where am I reading at now? Okay, here we go. So, did I read that already? Oh my God, I don't know where I left off. Who might, okay, I think I left off right here. Who might benefit from an IOP? Individual, oh, nope. Okay, I'm right here. Individuals who require more intensive treatment than traditional outpatient therapy can provide. And then also those who are struggling with everyday life despite individual therapy, and also individuals with co-occurring disorders, mental health, and substance use. All right, so I'm not going to read that. This is just talks about finding an IOP. Okay, so that is IOP. And then I got to talk about this one. There's more. There's more. The popular DBT. So if you have borderline, personality disorder like I do, DBT is what I recommend. Yes, I recommend PHP. I mean, who wants to go to IHP? That's inpatient. No one wants to be on a 3-day hold. But if you got to be on a 3-day hold, usually at that point it's too late. Once you're in, you're in. They'll check you in that facility. If they feel that you're in danger to yourself or others, there's no coming out. But DBT, I highly recommend you attend DBT if you, especially if you have borderline personality disorder. Now, it took me 5 years to complete DBT because there's different modules. They'll go over the different modules once I read about the DBT. But it takes a very long time because you have to go over each module, and you don't go over all the modules in just one session. Nope, that's not how it goes. So it took me 5 years to complete DBT. And I have a lovely copy from my therapy. My therapist gave me a lovely copy. Usually they give you like printed out handouts of DBT material, but I got the ringlet binder. So pretty, so organized, and I was lucky. She hooked me up. My therapist like, "Here, you can have this book." So I have all of my modules in a beautiful DBT book, not some Xerox copies and. But anyways, let's read about DBT now. So DBT is not I don't consider this level 1, level 2. This is just a group that is highly recommended of those with borderline personality disorder. So here it goes. It says it's DBT stands for dialectical behavior therapy. It is a type of therapy that helps individuals learn skills to manage intense emotions and improve their overall quality of life. I like that word management because remember, when we have DBT, you can't get rid of it, you can only manage it. That's all you can do is only manage it. It's an evidence based approach that combines acceptance and change oriented strategies often used to treat borderline personality disorder, emotional dysregulation, and other mental health issues. So, what is it? DBT is a structured therapy often involving individual and group sessions that focuses on teaching specific skills to manage emotions and improve interpersonal relationships. It's a type of cognitive behavior therapy, CBT, which I also will go over in a minute. I got that ready for you guys as well. That has been adapted to help people who experience emotions very intensely. DBT emphasizes both acceptance of current situations and the need for change. So here are the key skills taught in DBT. Mindfulness. So these are the modules I was telling you about. It's 4 modules, one of them being mindful. So mindfulness, learning to be present in the moment and observe thoughts and feelings without judgment. Another module is distress tolerance, developing skills to cope with difficult situations and painful emotions without resorting to unhealthy behaviors. Another module is emotional regulations, learning to identify, understand, and manage one's emotions effectively. And another module is interpersonal effectiveness. This one is improving communication skills, building healthy relationships, and setting boundaries. I think this one is my favorite. Interpersonal effectiveness is the module that really had me just glued. This one right here because of the boundaries. I talked about that before. That I'm a doormat. I suffer with being assertive. This module right here was like my fave, and I believe distress tolerance too. Distress tolerance and interpersonal effectiveness were my favorite modules. What were your if you took DBT before? What was your favorite out of these 4? What's your favorite module? All right, let's keep reading. Who can benefit from DBT? So individuals with borderline personality disorder, people struggling with emotional dysregulation, meaning they have difficulty managing the intensity and duration of their emotions, those experienced with self-harming behaviors or S thoughts, YouTube guidelines, S thoughts, individuals with substance use disorders, eating disorders, and other mental health conditions. In essence, DBT helps individuals learn to accept themselves while also working on changing negative or unhealthy behaviors, ultimately leading to a more fulfilling and meaningful life, according to psychology experts. Get in DBT, okay? If you have borderline personality disorder, or if you just learned that you got BPD, get in DBT. Oh my God, these acronyms. My brain. Did that make sense? Let me repeat myself. If you If I'm sorry, sometimes I crack myself up. If you these acronyms, man, I am just cracking up. If you have borderline personality disorder, please attend DBT. If you have BPD, if you have BPD, get in DBT, and also CBT, PHP, IHP, IOP. Woo, I'm on fire. I'm on fire. I mean, well, I'm sure you don't want to be an IHP. Who wants to, like I said, who wants to be on a 3-day hold? Okay, now CBT. This is the last group. How long is this video? Oh, wow. I'm up to 20 minutes. Okay. So the last one is CBT. Like I said, this is not a level 2. This is not a level 2, 3, 4, 5. This is also just another group that you can also attend. CBT, I only took this one time and I loved it. CBT focuses on your mind, on your cognitive. So what does it stand for? Cognitive Behavior Therapy. CBT is widely used form of psychotherapy that aims to help individuals manage mental health conditions and improve their well-being. Key principles of CBT: thoughts, feelings, and behaviors are interconnected. So it focuses on your thoughts, your feelings, and your behavior. It helps you in a nutshell, it helps you take control of your thoughts, behaviors, and your feelings. If you have like some kind of disordered thinking, like your thoughts telling you these lies and stuff like that, CBT is for you. So, cognitive distortion, see? So, CBT identifies and challenges negative or unhelpful thought patterns that contribute to mental health problems. Problem focused approach. Oh, I didn't read this part. CBT emphasizes that our thoughts influence our feelings, behaviors, and vice versa. Okay, so problem focused approach. CBT focuses on identifying and addressing specific problems and developing practical strategies to cope with them. Then it says here is skills development. CBT teaches individuals skills such as relaxation techniques, assertiveness training. Ooh, yes, assertiveness training. I need to get back in CBT. And problem solving to manage challenging situations. Benefits of CBT: effective for treating anxiety disorders, depression, obsessive compulsive disorder, also known as OCD, post traumatic stress disorder, PTSD, and other mental health conditions. Helps individuals develop coping mechanisms and improving their overall well-being. Teaches individuals to identify and challenge negative thoughts and beliefs. Provides a structured and goal-oriented approach to therapy. So, how does CBT works? Collaboration with therapists. CBT is typically conducted in collaboration with qualified therapists who guides the process. Self-reflection and monitoring. Individuals are encouraged to track their thoughts, feelings, and behaviors to gain insights into their patterns. Developing coping strategies. The therapist and individual work together to develop specific strategies for challenging negative thoughts and changing unhelpful behaviors. And then practice and reinforcement. CBT emphasizes the importance of practicing new skills and reinforcing positive changes in daily life. In conclusion, cognitive behavior therapy is a recognized and effective form of psychotherapy that focuses on changing thoughts, feelings, and behaviors to improve mental health and well being. It provides individuals with the tools and strategies to cope with challenges and enhance their quality of life. Woo! There we go. So, if you think CBT can be helpful for you, I highly recommend that you take CBT if you want to control those thoughts, feelings, and behavior. I want to click on this chart. It's very blurry. Let me move my little circle out the way. Give me one moment. I can actually move that. Let me move myself out of the way. That way we can read this little chart. All right. So it's blurry, but it says here. So this is how CBT works. So we have these thoughts, feelings, and behaviors, right? So here's the thought. Starts right here. The thought is, here's an example. What if they want to do blood work? So that's the thought. What if they want to do blood work? Then you jump into the feeling. You start to have anxiety and you dread going to the doctor. So it says anxiety and dread. That's the feelings. Then it jumps to the behavior. The behavior is you will cancel the appointment with the doctor. You see how that goes? So the thought, the feeling, the behavior. CBT helps you take control of this. Okay. That's why I wanted to click on that. So if you think you benefit from CBT, get yourself in there. If you never heard of it, this exists. Exists. This exists. Okay, let me get back on the screen. So that is all that I wanted to show you. There are many different groups, programs, and classes out there. These are just the ones that I've taken, and I've taken so many times. Like I took PHP probably 4 or 5 times. I was in PHP. I did IOP maybe twice, CBT once, and then DBT I had to take 5 years to complete all four of those modules, or 4 years, up to 4 or 5 years, because it's only four of them. But I was trying to take them back to back, but because of got to go to work and stuff like that, I was not able to take them back to back. I think that's why I said it took like 5 years to complete. But let me deactivate this camera and come on my screen because I want to now talk to you guys about, does it work? Does group therapy work? How was it for me taking, years of group therapy? Let me deactivate my camera and activate the big one again so I can come back on my screen. Give me one moment. All right, here I am. Okay, that was a lot. Sorry for the stuttering. That was very difficult to read. I tried to read that as smooth as I can, but let's get into it. So now I want to talk to you all about, does it work? And I will say yes. I don't want to make this a video about, I don't want to make this a take about discouraging you in going to therapy. I don't want to discourage you. It does work only if you speak, if you participate. Group therapy it is scary. I'm not going to lie. It's scary, especially if you're a quiet person, you're a person that's to yourself, you're a person that don't really like people in your business. I get it. I'm still like that when I attend group therapy. It's been a while. I did kind of, I put group therapy on hold because I split. I had a split in group therapy and I haven't been back in like, I don't even know how long, maybe like 2 years, maybe a year, almost two. Because I split on everyone when I shared something and they gave me that look like, no, sorry, you're on your own. I think I talked about that in one of my videos, how I was sharing something and then they gave me this look. I split on everybody. I was like, you know what? But I get it. It's group therapy is it can be very intimidating. You're put in the hot seat. But to be honest, that's the only way to heal, to gain something out of group therapy while you're there. You have to participate. They won't put you on the spot immediately. Like when you're new, they know you're nervous. You're just trying to observe, see how this thing goes. So they know you won't really speak. But I will say give it about a day or two. Start speaking. Share something small, but it works. Some people, like I said, they're like, no, I can't take this. People are looking at me. I cannot speak in front of all these people. I'm out of here. And then you're going to say, nope, group therapy don't work. Well, because you didn't try. You quit the same day. So I would just say, just give yourself a time, give yourself some time, be observant, listen to how people are sharing their stories, and then have that courage to speak. But like I said, it's not easy. One time it took me almost, I think, 4 days to finally speak. You're not there, even though it's intensive, the most you can be in these programs, I believe it's up to 2 weeks, and they can extend. Like if they see you need more time, depending on your insurance, it all depends on your insurance now. You can extend your stay, but typically they want you to complete it in 2 weeks. The ones that I attend out here in California, up to 2 weeks. I think I was almost 1 month in PHP, partial hospital program. I was in there for almost a month, I believe, maybe 3 weeks. But yes, so it works. Group therapy works, but it does feel awkward. It feels weird. You're talking about your issues in front of everyone. They're all looking at you, and then they do their group check in. They give you, like, you got to check in with your feelings. You don't have to say your name like, hi, well, actually, yeah, you do. You say your name. Sometimes you say your name. Hi, I'm blah, blah, blah. And I feel anxious at a 7, stuff like that. Or they'll give you an evaluation sheet you fill out in the beginning of the group. You fill out the evaluation sheet and then you turn it in because they want to see if you're progressing, if you're progressing, or if you're going back, like if you're relapsing. They have you fill out these evaluation sheets. But yes, everybody checks in. They go all around the room. You check in with a feeling and then you rate that feeling with a number. That's why I like to number. If you notice my videos, I like to number my emotions. I get it from group therapy. So, yes, if you're new to group therapy, you never taken it before, I will say it's going to feel, you're going to want to be like, nope, this is not for me. Because it's weird. You're in the, you're placed in this in the hot seat when it's your turn to speak. And but it worked. It works. It does. And there was times that I felt like, nah, this don't work. Even though I shared, I still felt like, nah, this is just not for me. Like speaking in front of everybody and going over my issues and my problems that I was having. I think at that time I was talking about work issues. So a lot of my stuff I was talking about work, but some people are in there, they need to discuss more personal stuff than just work issues. We have people that share all sorts of stories. I want to make another video that's going to be kind of related to group, since I'm talking about group therapy. I want to talk to you all. I want to make a video about different types of people to expect in group therapy. So this video is already long enough. So be prepared. I may make, this is probably going to be my next upload. I want to make a video about different types of people that attend therapy. I have stories of different types to expect. So if that's something that you're interested in, be on the lookout for that video. Like I said, it might be the very next video. Maybe not. I might talk about something else. But yes, in a nutshell, it worked. Group therapy did work. It's I'm still on the fence with it, like, I really don't, like I said, CPT, I want to attend. I did like DBT. And I might go over more of that. I will show you my module because that's my goal of my channel too. I don't want to spill too much of my channel, um, my future channel goals, but I will be talking a lot about DBT. It's like some kind of study thing I have in mind for my channel, but I don't want to spoil too much. But that is what I have in mind for my channel, is going over DBT skills together. How exciting! So, like I said, once again, in conclusion, group therapy does work. You just got to put in the work. You have to participate in order for it to work. You can't just shy up and just sit there just to listen to other people's problems or what they're dealing with. You have to participate. And it works. It does. And some people will support you. If they see that you're crying in your chair, you're gonna have some people crying. That's why I said I want to make a video about different types of people that attend group. But you're gonna have some people crying, and people's like, "Hey, no, don't cry. You're doing great. There's people in there that will support you. There's people in there that will support you." So, like I said, I don't want this to be a video to discourage people in going to therapy. That's why I'm not trying to be too harsh. But I will say that it does work. It does. People, when you get to your last day, you do feel accomplished. You do feel better, because when you first go to group, you feel like crap. When you first attend group, you're just like, I feel like, oh my god, I feel so bad, or the world sucks and stuff like that. You feel terrible, and then on your last day, you're smiling more. You feel better, and these people that feel that way are the ones that shared. When you share and participate, you get it off your chest of why you're there in the first place. You will end up leaving like that. Like I said, you go to group therapy feeling like, man, this is not going to work, and then you leave there feeling good. It all depends if you share. Healing Speaks. That's why I made my channel called Healing Speaks. You got to participate. You got to. So that is all that I have. This is a very long video. If you watch to the end, you are super duper. I'm sure my lovely family, I consider you my family. Remember, I consider you my family. If I see that you're commenting and you're giving me support on my channel, you are my family. I'm sure you guys are the ones that watch this whole entire long video, and I love you for that. And I love you all. Even if you're shadow watching, shadow watchers are the people that just don't really comment, but they will watch your content. I love you too. I love you too, because I do that too. Sometimes I will watch people's stuff and I just don't comment. But yes, but that is all that I have. Remember, I love engagement. So you can be in my comment section if you have a question, a concern, you need my advice. I'm not a pro in therapy, but I have attended enough therapy to, give you some advice. I've been in therapy since 2013. So I did a lot of groups, therapy, this and that, you name it. So I can try to help you out. So, let's encourage some engagement. And I would love to hear if you have anything that you want me to talk about. Let me show you my group therapy, my group panel session, my group discussion panel while I'm here. So yes, you guys, this is what it looks like. Now I can have my camera off I recommend that your camera is not on. I want everything to be confidential. So yes, you won't have your cameras on. It will just be yours. It'll be strictly voices only, your voice only. But this is my group discussion panel that I've been bragging about on my videos. So like I said, I can take the camera off, of course. I can take my camera off. Hold on, let me see if I can find which one is. There it is. So see, I can do that. We can all just. I haven't changed the colors yet. I remember I mentioned that I do not like the colors. Maybe I'll keep it. That gray and green looks kind of good together. So yes, this is my future, my channel's future of of what the aim, what is going to be geared towards. We're going to all just support one another, and I have awesome lineup things that I want to do when I go live. Remember the this direction of my channel is me going live, bringing you all up. You click a link. That's why it says there on the bottom. Click a link, and we're gonna support one another. I have like things that we can talk about, like topics. So as you can see, it says, what are your thoughts about today's topic or today's discussion? So I will be having like a topic of the day or something like that, and get your feedback on there. Maybe give another lesson that I found from the internet or something like that. Give a lesson, and if you want to put your 2 cents in, and you want to discuss what I've presented to you all, then that's when I bring you up. So yeah, this is my. Hold on, sorry. Let me trying to put myself back on camera now. I don't know how to put myself back on camera now. Lord. But anyway, oh yeah, this one right here. Okay, here I am. Sorry, I was like, wait, how do I figure this out? So yeah, this is it. And I can't wait to get this active. I can't get it active yet because, like I said, I'm looking for some more subscribers and stuff and more supporters. And then I will be able to open this up. I do want to go live on my cell phone, on my mobile, but I can't go live on my phone yet because I can go live on the computer. This is my computer. I can go live on it. Um, but I just can't go live on my phone yet because I need at least 50 subscribers. I believe I'm at 23. Once I get to 50 subscribers, I can go live on my cell phone and just check in on you guys and just go, quickly go live for like 10 minutes and see who can join. So yeah, hopefully I get some subscribers and stuff so I can at least go live on my cell phone. But anyways, this video has been long enough. This video has been long enough. Thank you all so much for watching. I hope you watched to the end. If you did, you are super. You are amazing. And thank you so much for your support. If you're new to the channel, be sure to hit the bell so that way you'll know when I upload some new content. And I hope you enjoyed the video. I know it was a lot of information, lots of acronyms, and hopefully I didn't bore you with all that reading. But I hope I was able to answer that person's question about how was group therapy for me. I hope you guys took some advice and learned something from group therapy about sharing and participating, and it's a huge part of healing. When you're in group therapy, you got to share, you have to participate or it won't work. And so yeah, that is it. I will definitely see you all in the next one and in the next video, and thank you so much.